this. There are already implemented programs. But if there is something that we can offer in addition, we would be happy to hear from Dr. Edsel Salvania, member of the Technical Advisory Group for COVID-19 and infectious disease expert. Dr. Salvania, you have the floor.
Good afternoon, Mr. President. Good afternoon to the cabinet members and to my fellow resource persons. May I have my slides up, please? Presenter. All right, Mr. President. So I'm just going to give a quick briefing about IHU and the latest also on Omicron po. Next slide, please. Next slide.
What's happened with the technical guys? Ayan.
So yung IHU po kasi, this is not an official variant of concern or even an official variant of interest. Ang World Health Organization po ang nagsasabi, ang nagde-designate ng variants of concern and variants of interest. IHU is the name of an institute in France po that described this particular lineage of the virus. And the WHO has already been monitoring this since November of last year. Ito po yung lineage na B.1.640. At so far, marami po siyang mutations, pero wala naman siyang pinapakitang parang survival advantage or immune evasion na nakikita natin sa Delta or sa Omicron. It's a variant that is being monitored, but it is not yet as concerning as Omicron or Delta or even the other ones po, like yung Alpha, Beta at Gamma. So ito po ang release ng WHO. Ang sinabi po nila, it is not a threat at this time. So it is something that we are monitoring. And even the people who wrote the paper from IHU, ang sabi nila, it is too early to speculate on the virological, epidemiologic, or clinical features of this IHU variant. So the bottom line po, Mr. President, is we will continue to monitor this po. But right now, I think our attention really has to be on Delta and Omicron because this is really wreaking havoc all over the world. Next slide, please. I think that's the back one. So in summary po for IHU, IHU is not a variant of concern. It is not exhibiting increased infectivity or immune evasion at this time. So gumagana po yung bakuna natin for this. WHO is monitoring it, pero hindi pa po siya VOI or VOC. It's designated as a VUM po. Actually, nanay niya yung designated na VUM, yung B.1.640. The thing to remember po is that yung mutations po natin, kahit madami pa yung mutations, they do not necessarily translate into immune evasion or more transmissibility. Kung naalala niyo po, Mr. President, yung P3 natin or Theta na describe una dito sa Pilipinas, dati po naging VOI yon, it was called Theta, tapos naging VUM, variant under monitoring, tapos natanggal na lang siya. Nakakatakot siya kung titingnan natin yung mutations niya, but it did not pan out. Actually, tinanggal na siya sa monitoring. So hopefully, ganito rin po yung mangyayari sa IHU. But of course, we have to continue to be vigilant kasi marami po talaga itong na-generate na variants, especially among people who are not vaccinated. Yung mga hindi po bakunado, mas madaling mag-mutate po yung virus sa kanila. So in a way, if we vaccinate a lot of people, we are also preventing the emergence of these variants. So ang conclusion po ng WHO is that IHU is not a threat at this time. Next slide po. So just to update you, Mr. President, on Omicron, and we are getting more and more data about this, it really is more transmissible than Delta, particularly because yung vaccines na hahawa pa rin kahit fully vaccinated. Although our vaccines continue to work naman to decrease the risk of severe disease. It is less deadly compared to Delta. Nakita na po yan in comparing 500,000 people with Omicron and 500,000 people with Delta in the UK. You are 3 times less likely to get hospitalized with Omicron compared to Delta. And of course, that goes down even more kung bakunado po kayo. And the vaccines significantly still protect against severe disease. Giving boosters will add more protection, and vaccines also decrease infectiousness and risk of mutation. So if you're vaccinated, may chance na mahawa ka, pero most likely magiging mild po yon, and even yung paghawa mo sa ibang tao, yung risk goes down kasi mas mababa po yung amount of virus that you release into the air. Next slide, please. So ito po yung naging curve po sa South Africa, yung sa Gauteng province nila. Nakita po natin, mataas yung number of cases, yun po yung sa December, mataas, pero yung admissions are not so high. And very, very reassuringly, the deaths are not following the rise in cases. Of course, pwede pang magdagdag yan, pero we don't expect it to be as bad as Delta. Kasi kung titingnan nyo po, yung graph before that, yung pagtaas po, kasama po yung hospitalizations at yung deaths, halos sumasabay sila. But for Omicron, kasama na rin the fact that there are some vaccinated people in Gauteng, hindi po talaga sumasabay yung death. So even if we're seeing many, many cases, basta mataas ang vaccination rate natin, we hope that the number of people who will end up in the hospital will remain relatively smaller and the number of people who will die will remain low. The problem is, yun nga, pati yung healthcare workers natin nagkakasakit eh. So, kailangan po talaga natin rin silang protektahan. Next slide, please. So, ito rin po yung pinakita sa ages, yung Omicron wave across the board po, whatever age, mas mababa po talaga yung risk that someone will end up in intensive care compared to Delta. So, it is not zero. So, meron pa rin talagang magkakasakit, magkakaroon ng severe, but it is about half that of Delta. So, in a way, that helps us because then yung healthcare capacity natin will hopefully, as long as maraming bakunado and we can keep infection rates under control, we may be able to cope. May laban po tayo as long as mataas ang vaccination rates. Next slide, please. So even in South Africa, sobrang taas po nung cases nila, but then it started to go down in a matter of about 4 weeks. So magpipik po talaga ito na mabilis. We expect na mabilis po talaga yung pag-akyat nung cases na nakikita po natin, but hopefully we follow the trend that happened in South Africa, very quickly bumaba rin. Dahil kung maraming bakunado, mauubusan rin ng hosts eventually itong Omicron. Ang problema po natin yung mga provinces na mababa pa ang vaccination rates, pag makaabot ang Omicron doon, baka sila ang magkaroon ng severe disease if mababa pa yung bakunado, especially among the vulnerable population. But here in Metro Manila, Mr. President, we are hopeful as long as we can keep our healthcare system open, that even if we see 20, 30, 40,000 cases in the next few days, as long as many of those are vaccinated, the stress on our healthcare system will be manageable po. Next slide, please. So how do we prevent Omicron? Our face masks, our face shields, physical distance, these still all work. Ang problema po kasi talaga, it's not 15 minutes na lang eh. Fleeting contact lang, pwede kang mahawa from Omicron. It's very, very contagious and it spreads very fast. If it takes 5 days to get symptoms from Delta, it only takes 3 days to get symptoms from Omicron. So mabilis yung paghawa niya kasi when people have symptoms, mas nakakahawa sila. The treatment is the same for the most part. We are able to treat the most severe patients with the medications that we have. But it is also very important po na we have to keep our hospitals open. We have to prioritize the sickest of the sick. Kasi hanggang ngayon meron rin pong mild tsaka moderate na napupunta pa rin sa ospital, and that is crowding out people who really need to be in the hospital. So we hope that as long as maraming nabakunahan, we can actually take care of these people at home safely, because the risk of bad disease kung Omicron yan and fully vaccinated sila is very low. Parang sa flu lang po. So again, basta bakunado, kahit mahawa ng Omicron, chances are it's going to be mild. It's going to be like the cold or the flu. And as long as they are able to isolate as soon as possible para hindi sila makahawa sa ibang tao, we will hopefully will be able to ride out the Omicron wave po. Next slide. So in summary po, ang Omicron po mukhang milder po talaga siya than Delta, which is good news. But the bad news is it is very transmissible. And then the good news is that the vaccines will prevent severe disease. They continue to work. And if you get Omicron and you are vaccinated, most likely mild lang po talaga. Even my own patients nakikita ko, nung nasa Delta po, pag meron po silang Delta, yung lungs po nila, sunog na sunog po talaga. Pero ngayon itong mga Omicron patients ko, lalo na yung fully vaccinated, napakalinis po ng lungs nila, and usually mild lang talaga yung disease. But of course, they still take up space in the hospital. So we really have to triage properly. Yung pagbo-boost po natin was a very good decision because the data is showing that boosting further protects against hospitalization and transmission. We have to protect our healthcare system. Marami pong healthcare workers po ngayon, Mr. President, ang nagkakasakit na even though mild naman yung nakukuha nila, it's still a strain on our healthcare system kasi wala ng nurses, wala ng doctors. Pati ako po ngayon, quarantined ako kasi may exposure po ako, although wala naman po akong sintomas. And my last test po was negative naman, but I need to quarantine because na-expose po ako. So we expect very high numbers of infection, but if many of us are vaccinated, we will be okay po, Mr. President. Thank you very much.
Salamat, Dr. Salvania. You know, just an observation. I was appalled to see on TV the other day that there are still thousands in Metro Manila lining up for the jobs. So kung ganito sila maybe they are willing but nagpo-procrastinate. That's a problem, procrastination. Marami pa talaga ang wala eh. So that would keep the barangay captains busy to personal. Kung wala na sila na ang mag-survey, just simply asking people if we are vaccinated. And if he gets the real truth about sa tao, then just request him to her or para walang gulo, iwas tayo. We do not want trouble. We do not want to be imposed on you. Just stay so that we will all be safe. Yan lang naman eh. Talagang naataka ako na napakarami pala to ang wala pa. So, hindi na lang hintayin kasi pag nagpatong-patong, pag nagtapatong COVID, at saka sumakay itong si Omicron pati si Delta, goodbye Philippines. This will be your, well, you can hardly survive kung it will attack yung lungs mo. I have heard a friend early on na ano siya, nasabi ko na to sa inyo, but I will repeat it for those kasama ko sa motor. Tumawag siya, sabi niya, tulungan mo ako kasi hindi na ako, I can hardly breathe. Ang asawa niya sa ospital rin. So, Sabi ko, nandiyan ka naman sa ospital. Maybe I can just also call their attention. Sabihin ko na pakidalian lang ang gamot kung meron para sa kanya at asawa niya. You know, it's very tragic. They have only one child, a daughter, pero malaki naman. The following day after he called me, ang asawa namatay. The day after, Bisaya ako, ang asawa kasi babae sa Bisaya. Bana is the husband. Namatay rin. So, kaawa ang tao talaga. So, hindi na ako nagtanong kung nakapagbakuna ka. Aga pa yun, first week of the onset of the contamination of the city. Siya pa ang tinamaan. Kayong mga hindi pa, makiusap na lang ako sa iyo. Huwag na lang ito daanin sa galit-galit. May I just really earnestly request you to get your vaccine. Do not procrastinate. Sabihin mo bukas na. Because the bukas might be the day that will you start to die. Pag nagpatong na ito. Kasi wag kayong kindly tune in. Kung ayaw kayong marinig sa akin, okay lang. But listen to the experts. Because it will save us all. Alam mo, sabi nga ni Dr. Sabanya, ang mapunta ka ng hospital, ang hospital ngayon puno. So we are activating the places which we originally intended to be a hospital or extensions of hospital, yung Rizal Memorial Stadium, I think, and the others, gagawin na natin, prepare those places because this is really getting worse every day. It's very fast. Ang problema niyan, kung madapuan ka sa lahat at nagpatong yan and you get the original COVID-19, I do not think, kaya nga yung mask but you have to pardon me, I don't feel, tignan mo, ang boses ko wala na. Huwag dumadating ang mask. Pero pag tanggalin ko ang mask, maganda na ang boses. Marig na ninyo ako. So, well, that's just an observation. May I call on, again, maistorbo ko kayo, Mr. John Wong, you may add something to what we are facing now. Dr. Wong, John.
Good afternoon, Mr. President.
Yes, good afternoon.
I agree totally with Dr. Salvana. No? In the face of this Omicron, even though it's mild, no? And so far very few people have died, no? We need to reduce transmission, and we can do this by reducing mobility, reducing contact, no? Encourage people to wear masks, no? But also to get people to test right away, no? When they're symptomatic, no? A lot of the infections are spreading, or a lot of the transmission is spreading because people are symptomatic, but they wait a few days before they get tested, no? All the while caring about their businesses, no? But most important of all, I think we need to vaccinate the rest of the population because a lot of the people in the hospitals now, no, both locally and also globally, no, where in many of the countries with Omicron, a lot of the people in these hospitals are people without vaccination, no, not people who have been vaccinated but do not have boosters, no. So it's the unvaccinated, no, rather than the unboosted that we have to prioritize, no, especially the elderly. Thank you, Mr. President.
Okay. Are you through, Dr. Wong?
Yes, yes,
Tapos
Mr.
ka na.
President.
Well, it was a good reminder for everybody. Ako kasi, I know that there is a problem. I know that it is progressing, it's getting worse every day. Now, ako kasi, by nature, pag may problema ako, kima-personal ko sa buhay nito, I imagine the worst, how far it can go to make me unhappy and sad or afraid. Tapos, inaano ko talaga, what's the worst that can happen? Yun ang iniisip ko din. Slowly, I try to rationalize everything. Maybe I can do this, I can do that. Hanggang meron akong structural way of solving the problem. Dito kasi, because of the how fast it's going, we have to look at the problem on the worst case scenario. Total, kung preparation natin, tapos it will simmer down into something na hindi masyado, walang mawala sa atin eh. Ang problema, kung talagang bahay por bahay na ngayon eh. So, it affects all the members of the house or home. Ang problema, how do we meet this huge challenge? Kaya we have to activate yung mga facilities that were converted into parang extensions of the hospital. Now, isip ko kasi kulang talaga, as you have said, kulang tayo ng medical guys. This is just a suggestion. If it is not good, then just let it pass into from ear to ear. Yung mga, anong tawag ninyo, ma'am, yung doktor, yung mag-graduate na, yung naghihintay na ng results ng o basta yung tapos na. Maybe they can help this country, their country, his country, her country, by volunteering to assist us kung gusto lang nila. Total, they have the knowledge of how to protect themselves. At least the barest minimum that they can do to protect them, maybe they can help us by volunteering, or baka may naman to, baka they would want to, sabihin na natin pagod kasi pamasahe, if they have their own transportation vehicle, private, gagastos rin sila ng gasolina. We will just, hindi naman token, but yung sweldo ng gobyerno, it's good for 8 hours. Magkano nga ang sweldo ng isang nurse? Magkano ba ang going rate ng nurses? Wala ako, but Secretary Duque can find out. Well,
yes, Mr. President.
How much did you pay for those guys who volunteered dito?
Sir, binibigyan lang natin sila ng stipend. What you're referring to are the postgraduate interns waiting for the results of their board exams. So they are being asked by the hospitals where they finished their internship to help, to volunteer. So meron na po tayong programang ganon na nakakatulong po sila on top of our regular human resource for health. And we also have an augmentation program, Mr. President. So if hospitals are overwhelmed in Metro Manila, as an example, because of the very high cases, we deploy and augment our healthcare workers from the Visayas and Mindanao and from the neighboring Luzon DOH hospitals to help, especially when they're coming from uh, areas with low cases, low number of cases. So we are also putting together, and which we have done before, as per your instruction, yung augmentation from the Philippine National Police as well as the Armed Forces of the Philippines. So we are making sure that all available healthcare professionals will be on deck uh, and prepare for the worst case scenario. Tama po kayo, sir. We really have to prepare for the worst case scenario. And that is exactly what we have started to do, Mr. President.
Ay, sir, kasi inimbita ko ang armed forces. I wanted to talk to them, pati ang police. Because if it comes, the worst that can happen in our country, it will be a business for the military and the police to maintain order and help the civilians. Whatever. Sarado ang mga hospital. They are refusing new admissions kasi ano na, it can become there might be some, alam mo na, we want to help, and if you just can wait, we will mobilize all persons. Pero kung maggrabe ito na lahat tinamaan, bahay por bahay, hindi sabihin nagmarsyalo. No, not that. The military has to sacrifice. Kunin nila yung ano, kung saan nila dalhin, o police. You know, that's, hindi lang kasi na nakaintindi ang publiko ng role ng military pati police. Lahat ng ano natin, bagyo, landslide, sunog o riots, it's always the police and the military. Lahat yan nila. If there is to be dug sa landslide, police yan. Ang police kasi, pag sinabi maghukay ka dyan ng patay, they not say no. That's the reason why hindi ko naman love the military and the police. I'm just kind of I treat myself as one of them para maintindihan. I think like a military, because I have dealt with them over a period of time, and the police because they were under me when I was mayor. Nakukuha ko yung ano nila. So ito yung mga tao na sabihin mo na gawain mo yan. Yan ang, so they should prepare for that eventuality. You know, pagdala ng ano, at least the barest minimum na, if you want the maximum protection, you can use a double mask or something. Maybe spray yourself with meron dyan mga bago. Sprayhan mo lang yung sarili mo ng para kung madapo. Mahirap kasi nandito kasi mayroon dito kanina na madapuan ka lang. I cannot understand na dapo na physical contact o handshake o baka lahat na yan. So contactless. Less ang contact, the better. We are not in the same league with other countries. America is suffering nearing a million mark sa ano nila, kasakit. And we do not know if it is a new variant or it's still the same COVID-19 that's overtaking the health of everybody there. Tayo, we are 10,000. It's time to activate what we have prepared for a long time. We prepared for something like hospitals, auxiliary people, and this time I would call on my countrymen, the young doctors and nurses waiting for the results of the exams, and if you want to help, I can give you the allowance that was given in magkanong sir, magkanong Secretary Duque, magkanong bigay mo sa mga nung tumulong?
Yung po mga tumulong, Mr. President, kung yung meron po tayong tinatawag na special risk allowance na nagbibigay po tayo, I think mga 5,000, but that will depend on may criteria po if they are actually directly catering to patients or in contact with COVID-19 patients. Yun po yung binibigyan natin ng special risk allowance. That includes doctors and healthcare workers from the private hospitals. Samantalang sa government hospitals naman, on top of the special risk allowance, we are also giving them the actual hazard duty pay. And also, these are on top of their compensation or salaries, Mr. President. So dagdag po ito based on your directive since 2 years ago when the pandemic struck or began. So ito pong mga postgraduate interns, we can actually come up with a compensation kasi habang wala pa yung kanilang board exam results, pwede naman po sila magtrabaho, mag-volunteer. But we can incentivize by giving them a certain amount. We will have to determine that. Although ang mga doctors kasi, Mr. President, na first-year resident will receive about 59,000 pesos a month. Yan po ang kanyang sweldo plus other benefits. So we can start using that as a benchmark, Mr. President.
I think that the 5,000 is masyadong maliit ngayon. Considering the attendant danger to the guys, medyo they should be given more. You take into account the possibility of danger. They themselves will get because of they have to go near and they have to treat those people. I will increase. Hindi ko pa masabi magkano. Wala mang budget dito. Wala. Ikaw bong.
Mr. President, yung 5,000 that's on top of a much higher compensation. Parang ko lang ho yun, dagdag lang ho yun doon sa binibigay natin ng mga salaries sa ating po mga healthcare workers. So tama po kayo, 5,000 is a pittance that will not really attract or properly incentivize these volunteers, no? Considering the risk that they will face. So a much higher amount is in order, Mr. President. Salamat po.
I agree with you. And I have, well, to those who are entertaining the idea of getting into the role of volunteers, I will raise the amount. Basta total, ano man naman yung pera? ubusin na natin yung pera nitong gobyerno to para sa inyo. Kung wala na, maghintay na lang tayo ng lahat. Just, but I do not think that we'll run out of money. Secretary Dominguez is a very resourceful person. Wala naman tayong, nandiyan naman ang World Bank, hiram tayo kung wala na pera. Pasalamat rin tayo doong tumulong dito, but I would do it during my extra time later. I would like to thank the people and the countries that extended their helping hand. So let us complete our story here about the COVID. I now call on Dr. Marisa Alejandria. He is the member of the technical group of COVID-19 and infectious disease expert.
Good afternoon, Mr. President. Thank you for this opportunity to share information also on Omicron and to remind our public on how to prevent transmission of this new variant. The concerning feature of this variant compared to Delta, again, we'd like to emphasize the high transmissibility of this variant. So, mas mabilis po siyang makahawa, kaya ang advice po natin sa public is to isolate right away, even if with just very mild symptoms. Kahit wala pang result, kahit walang test, at wala pang resulta yung test, dapat mag-isolate na po kasi mabilis po siyang makahawa. Buong household, madaling mahawa. Kaya ang isa naming recommendation nga po is mag-isolate na yung buong household once merong isang may symptom. So, may mga guidelines po on how to manage mild cases at home na ipapamahagi namin sa publiko para hindi na po sila kailangan pumunta sa ospital kung mild lang yung cases, mild lang yung symptoms na nararamdaman, bakunado, so pwede po silang alagaan sa bahay para hindi po mapuno ang ospital. Preserve natin yung hospitals for the severe and critical cases and for other cases na non-COVID na nangangailangan ng hospitalization. So, yun po ang pakiusap natin sa publiko. And then, wear mask properly pag lumalabas ng bahay. Then, of course, hand hygiene pa rin. Lagi tayong maghuhugas ng kamay. And then, we avoid crowding, super spreader events. So, kung pwede pa rin talaga iwasan yung translasyon, Chinese New Year celebration, tsaka yung Santo Niño, no? I think that will help, no, in the next few weeks that we expect the cases to still continue to rise dahil mabilis nga po itong variant na to. So, and then we can also have teleconsults, no? Dito pwede yung ating mga postgraduate interns, volunteer doctors, no? We can utilize them for teleconsults, telemedicine, to provide guidance to our community who are experiencing symptoms to assure them that they can be managed at home. Yun lang po, Mr. President.
Salamat, Doktora. Then, Doktora Cynthia Saloma, the Executive Director of the Philippine Genome Center.
Good evening po, Mr. President, and thank you very much for the opportunity to speak to you and to the Cabinet today. Gusto ko lang pong sang-ayunan yung mga advice ng ating mga public health experts tungkol po sa mga things that we have to do and the things we have to prepare. So yung sasabihin ko po, Mr. President, dagdag na lang ito sa mga advice nila. I think, Mr. President, honestly speaking, it is very important that we prepare our public for the daily news na talagang tataas at tataas ang kaso, primarily because of the nature of the Omicron variant. So, Mr. President, if you look at the data from the other countries that are experienced with the Delta, Alpha, and Beta before, Normally po, President, yung ating mga cases dito sa Pilipinas, yung peak natin nagdi-delay ng mga 1 month to 2 months. Pero itong Omicron, ang bilis ang pagtaas na. So we're looking at figures na 5,000, tapos 10,000, tapos 70,000 today, and tomorrow it will be much higher. So it's very, very important that we manage these numbers as perceived by our public kasi tataas talaga po ito, Mr. President, considering the fact na yung signature ng Omicron, hindi gentle wave, is always like a needle ang taas-taas niya, no? So that is one that we have to manage. And of course, we know that because of our vaccination and prior exposure, ang mga cases in general, milder and asymptomatic. But because of the sheer number of potential cases po, President, sa Omicron, meron talagang mag-overwhelm o dadami ang ma-ospital. Kaya ito importante nating pag-andaan. Tapos, Mr. President, isa pang importante din, and this is also the experience of other countries, is na-overwhelm po yung testing centers. No? So, ang haba-haba ng mga linya. So, you will notice, for example, Australia with 92% vaccination, 64,000 po yung positive nila kahapon or today. And of course, France with 300,000. And other countries, these are countries with much, much better resources than us. And yet even their testing centers are stretched. Kung minsan nagkukulang po yung kanilang kits. So siguro paghandaan din natin together with the DOH and other government agencies kung paano po natin i-maximize itong testing kasi we don't want na yung mga tao manghaba-haba ng linya nandoon sa labas ng testing centers nagpapatest. So there should be preparation on how best to maximize the testing. Possibly, we should only test healthcare workers, those with comorbidities, and those na 60 plus and above. Kasi I already anticipate, Mr. President, that this will happen as the cases, if the peak of Delta is about 26,000 in September, we can anticipate based on experience from other countries, double, triple, 4 times this amount. And for that value to be there, the testing should be 5 times that number. So it's very, very difficult to reach those numbers. So it is very, very important that we prepare for that possibility at the level of the testing. Siguro i-maximize natin yon. And at the same time, Mr. President, on the one hand, we would like to assure our public that with vaccination and the practicing of our public health measures, ang atin pong kaso mas kaunti yung mapupunta sa ating mga ospital. But because masyadong maraming kaso at may mga tao pa rin hindi nabavaccinate, then it's going to fill up some of our healthcare facilities. So these are the things that we have to plan out and prepare our public for. Eventually, Mr. President, bababa din itong kaso, but we do not know how the peak will happen and what is the time frame that this will do. Based on the experience of other countries, it's about 4 weeks, but we don't know the peak that we will reach. But in the meantime, lahat ng magagawa natin at mga preparations na magawa natin kailangan, we have to put in place. At marami na rin po tayong, Mr. President, natutunan tungkol sa Delta. Pero yung Omicron is a different animal altogether because ang bilis talaga po niya, President, tumaas eh. Can you imagine values 5,000, 10,000, 17,000 tomorrow and the next day, ilang numero ito. So this is something that we have never seen before, but of course we are protected with our vaccination. But it is also very, very important that we prepare our public for the numbers that will come out as the daily reports are released by the Department of Health. Yun lang po, Mr. President.
Salamat po, ma'am. Let us proceed with the reports from the field force. We have Secretary Anyo, who will report on us on the prevention, implementation of prevention and detection, isolate, treatment of reintegrate vaccination, PDIR plus B. You have to explain this to us. Hindi ko intindihan to. NCR updates and that belongs to chair of the MMDA, Attorney Abalos. Secretary Anyo, can you proceed?
Thank you, Mr. President. Magandang hapon po sa ating lahat. Please, next slide. Mr. President, Ito po yung ating paghahanda na ginagawa dahil po sa ating Omicron. Ang ating pong LGU ay nagsasagawa ng a more aggressive PDITR or prevent, detect, isolate, treat, and reintegrate plus vaccine strategy. So makita po natin dito sa ating datos po, meron po tayong enough contact tracers po nakadeploy. Ito po mga barangay health emergency response teams ang ating inaasahan ngayon dahil sa dami po ng hawaan ngayon ay umaasa po tayo sa granular lockdown at house lockdown. Katulad nga po ng sinabi na kung meron pong isang nahawahan, more or less ay buong pamilya na po. Kaya mag-house lockdown tayo. At meron naman po tayong enough medical personnel din po. Sa atin naman pong isolation and treatment, ang ating pong mga quarantine facilities ay naka-ready na rin po ang isolation facilities. At hinikayat po natin na talagang yung mga severe po lamang ay i-reserve natin sa mga hospital. At kung maaari dahil naman po mild naman yung mga symptoms, ay pwede na pong home quarantine at home care na lang. At sa vaccination naman po ay meron po tayong pinaplano uli, katulad ng sinabi ni Secretary Charlie Galvez ng isang another national vaccination. Kasi ito po yung nakikita talaga natin panlaban sa ating bagong Omicron variant. Hiningi po namin yung cooperation at support ng ating mamamayan. Be responsible for your own family. Kung meron pang hindi bakunado sa inyong pamilya, kayo na po sana ang mag-encourage at mag-influence para po dalhin sa ating mga vaccination sites, lalo na yung mga A2 at A3. Itawag po natin sa ating mga LGUs, may programa po tayo para magbahay-bahay. Next slide. Additional din po, Mr. President, dahil po nga nagkakaroon ng parang artificial shortage sa mga gamot, kahit po sana natin yung mga mamamayan natin na huwag mag-panic buying. We have enough medicine po para to treat yung symptoms, pero yung iba kasi ay nag-i-stock na sa bahay, kaya po nagkakaroon ng panic at ang pagtingin po ay parang nagkakaroon ng shortage. So sana po ay makisama ang lahat sa ating, kaya naman natin pong labanan itong Omicron variant na to. Kanina po sa aming pagpupulong sa IATF ay magkakaroon po ng mga pagbabago sa mga palisiya, lalong-lalo na po sa isolation, sapagkat nakikita po natin na mapupuno yung ating mga isolation centers, kaya tuturuan po natin yung ating mga kababayan ang mga tamang hakbang kapag mag-home care para sa ating mga positive na nag-isolate. Sa ating po rin mga business and private companies, inikayat din po sana natin na unang-una ipatupad ang pag-comply sa mga health protocols at bigyan po sana rin ng suporta ang kanilang mga employees. Nakikita po natin na maraming tatamaan sa Omicron. Ang unang maapektuhan po ay ang workforce sa mga companies, business establishment, hospital at even sa ating government services. So pagandaan po natin. At ating po mga kapulisan ay ating dineploy para siguraduhin po na mananatili ang peace and order sa interzonal at intrazonal movement. Sisiguraduhin po rin na maayos at ang ating po mga local government units po ay nakahanda naman sa threat ng Omicron variant. Yan lamang po, Mr. President. Magandang gabi po.
Thank you, Secretary Anyo. Dito muna tayo kay Dr. Oscar Gutierrez, Jr., OIC, the Food and Drug Administration. Sandali lang, may idagdag lang ako. Ang policy now is that there are departments na walang magtakbo, yung iba nag-resign. Kagaya dito. My policy is I do not take outsiders anymore. Kung sino yung second in command dyan sa opisina, departamento na yan, siya ang aakyat. No more outsiders para mas madali. Yung may alam na talaga, are those working permanently there. They are the ones, total pagdating ng bagong administrasyon, mapapalitan o they will go back to the same original position that they have occupied. So itong si Oscar is the second in command, the second person. Siya na ang magbigay ng report because he's the OIC. So, go ahead.
Magandang gabi, mahal na Pangulo, maayong gabi. So I will make a presentation on the FDA updates. So a total of 89 approved test kits as of January 4 are listed as approved by the FDA. So these test kits remain to be reliable in detecting COVID-19 infections. So next slide, please. As of today, we announced that we are accepting applications for special certification for COVID-19 self-administered or the home test kit. Yung pinakita ko kanina na slide, these are the kit that will require health professionals in conducting the test. So I am calling for all the manufacturers and even the importers of self-administered COVID-19 test kits that to register their product in the form of a special certification. And we already met with the DOH, and they will be coming out with an algorithm, actually a guideline or policy on the use of these home test kits, considering that these products need to be administered by the patient or the household themselves. So kailangan po natin ng guidelines on the use, reporting system, even disposal of the waste, interpretation of the test results, and what action should the individual take when he finds out that he is positive. So kailangan po natin ng algorithm from the DOH. And this will be based on the claims made by the manufacturers. But in general, we need a guideline on this.
Let me interrupt you. Ito bang self-administered home test?
Okay.
Para dyan sa household,
Opo.
could be the father, the mother.
Yes po.
Yung ba rin yung turok?
This will be yung nasopharyngeal is up to the pharynxes. Ito nasal lang, dito lang.
Nasal lang?
And it can be oral. So depende po, we are waiting for the manufacturers and even innovators to register their products. And we will know po kung they will be applying for the nasal type or the oral type.
I hope they would have
Mas less invasive po siya.
seminar in a GP personal, hanggang ano lang.
Opo.
Kami, alam mo, galing ako ng Davao hanggang ang order ng doktor, kami dyan, araw-araw.
Oh.
Kaya, hindi naman masyado. It's not really that hard. You do not have to suffer. Pero araw-araw na, sa bunganga, okay. Ang problema yung ilong, kasi ikot-ikutin.
Bali dito lang po siya sa nasal lang, hindi aabot dun sa mga
alam ko.
Venetia.
Kasi dito, ano talaga, nurse ang, tsaka nakatingin yung doktor.
Ito self-administered.
Pero, kaya nga, pero araw-araw, this has been going on for, pati doon sa Davao. Sus Mario Joseph, naghahintay na yung, akala mo na parang multo doon sa sa likod. Minsan, hapon na kasi ako. Nandiyan na yung multo. Nandiyan na. Tangina. So, yun ang just a comment. Kasi totoo naman kasi sino araw-arawin ka ba naman kami dito pati yung sila kayo ba Colonel ito si Kuni babae man to Colonel to araw-araw rin kayo kaawa sige, marami pala tayo nagdudusa good nakikiramay kayo.
Yes.
Ikaw, araw-araw ka rin?
Ay, hindi po.
Hindi. Kaya baka, nagdaan ka ba kanina sa
Dumaan po ako.
Kasi, kung hindi ka araw-araw,
Araw-araw po nag-iingat, nag-wear ng mask, ganyan. Nagugas ng kamay, social
kaya
distancing.
ganito ang problema. I'm just wondering, dito umiikot sa utak ko, why the massive contamination? Nga halos every household. I can only give, I'm not guessing, but I'm just formulating a theory that it was because of the holidays. Yung holidays kasi nagbaba tayo ng alert 1, so everybody was out, including children.
Including the unvaccinated.
Ito yung rest back na yun. This is the result of kasi bigla kagaya ng sabi, January 6, then, but it was only 5,400 cases. Then 2 days after, January 4 rather, January 4, 5,400. Then 2 days after, January 6, it's 17,200. Masyadong malakas ang almost exponential ang akyat ng so baka talaga ako wala akong ibang maibigay na sensible theory. It was because of yung everybody was out and people were crowding everywhere sa Divisoria, so walang social distancing. Those were the essentials or the basic minimum of observance ng ng mga experts na ito yung mask. Nakalahat naman nakamask pero ang tingin ko bakit so baby contact para matanong ako doktor, pati ba yung paglamano pwede kang mahawa or even just the body contact?
The proven naman po is by aerosol po droplets.
Kaya, so I'm just wondering why I said there are almost exponential rise in a matter of 2 days. Kaya yung tingin ko, it could only be a result of, there has to be a reason. Hindi pwede walang rason why the sudden rise, sharp, right, in a matter of 2 days. There has to be a reason for that. Hindi natin bagay, bakit marami na ngayon? So, ako, as sabi ko nga, ultimately, I'm the one to be blamed. Siguro yung New Year's Eve, Pasko. Pero itong bago lang ito, it could only be a recent yung surge. And it could be attributed, tingin ko, by the people yung New Year's, a day before the New Year. And incubation period is something like 7. Incubation period of the virus.
I'm not so sure about the incubation period. Maybe Secretary Duque can.
Yes, but
help me out.
kasi I said we have to. all, if there is nobody interested in it, but ako as dito sa inuupuan ko, I have to know the reason why. Kasi hindi ako pwede bakit ganito? Magtanong ang tao, bakit so sudden, so many? Then you have to have an answer. Yun ang ano ko, because of the holidays. Walang iba eh. Wala akong ibang mahanap na rason na bakit. Talagang ito na ngayon ang hinaharap natin. Of course, I'll ask Secretary Duque later. Bakit ganito? I am not really pressing you for an answer. I know that you are just too far away from the issue. Sige, you go ahead.
Yeah, sa next slide po, meron po tayong, meron pong EUA na na-approve, yung Ronapreve and Molnupiravir. Ito pong Ronapreve po, ito ay injectable po ito, I mean by infusion. Whereas itong Molnupiravir, it's the capsule form. So, dalawa po interesting dito, which we approved naman po October 1, 2021 yung Ronapreve, yung December 22 lang, very recently. Lloyd Laboratories is applying for CPR to manufacture it locally. So they completed the compliance requirements January 4, so it's under the evaluation po by the FDA, Center for Drug Regulation Research, and we will farm it out, of course, to our FDA drug advisory expert.
Okay. Let me ask you. Ito yung mga medicines. If at all, it should be given when you have already the COVID.
It's given to diagnosed patient with mild to moderate symptoms po.
Yeah.
Then we have a 5-day window period po to give it.
Kaya nga,
For 80 years old
maibigay
people.
ito yung may tama na, may
Yes,
symptoms na.
positively
It should not be
diagnosed.
given to a healthy person.
Yeah, and it should not be a substitute for vaccination po. It should not be given for prophylactic reason.
Right,
Ito lang po yung diagnose.
some guys might think that this is really a preventive thing if you
It
it's
should not
only for the person who has already the symptoms
be. Correct po.
of buti malaman nilang when a healthy person should not
Should not take it.
okay, thank you.
Okay. Sige po.
Salamat.
Opo.
You can go ahead.
Oh, yeah. Then the DOH will be coming out with the guidelines also on how this can be accessed as an oral drug po ito for mild and non-hospitalized COVID-19 patients. So, next slide po tayo. Then we have the Paxlovid po, another antiviral. On January 4 po, the Philippine government and Pfizer already signed the CDA, Confidential Declaration Agreement. And tomorrow po at 1 p.m., I will have a virtual meeting with the Pfizer company to discuss po their plans for application for an EUA registration. And we will discuss po timelines, including FDA requirements po, so that we can adjust po, we can level off po how they can comply with our requirements, considering that it is an EUA application, not a CPR application. For emergencies po talaga ito. We need this po in our country.
People might think about the confidentiality of things. These are one of the few exceptions that we cannot forgo. We have to sign it to get the medicine. Standard ho yan, everywhere, anywhere. Yung confidentiality, there has to be an obligation on the part of the beneficiary of the medicines to sign that declaration. Yung kasi yung iba kasi ng bakit hindi, it's a public, no, it's not. It is a public document, but it is confidential. Not all public documents are really open to everybody. Yan ang intindihin ng iba. Baka sabihin niya, baka may ano dyan ha, ang usual is mayroong kickback dyan, gano'n. So, may mga, yung putok bulinaw, bulinaw? Bisaya ka ba?
Kabalo ko sa Bisaya.
Bil-
Taga Davao man ko, sir.
Ano man Tagalog sa bulinaw? Bunilaw rin?
That small fry fish pa yun, small fish. Dilis nga. Pero smaller
Otak
than dilis
dilis.
pa.
Makita nilang confidential declaration, they always insist that the public should know. Kaya I'm just giving this advance information that we cannot get all of the medicine unless we comply with that confidential declaration agreement. And it applies to all. It applies to all yung ito ngayong mga medisina to fight the COVID. It's not only Pfizer, it could be Moderna, meron talaga yan. So it's a universal practice in the medical field. So we understand. You have to talk to them. And again, they would insist on the confidentiality of that. Kasali ka na dyan. And we understand. And I'm sending this message to the public so that, sabi ko nga, yung utok bulina would start again to question and doubt the sincerity of, ang problema kasi sa kanila, pag may makita sila transaction, well, of course, they are free to entertain doubts. But these are things which we cannot do, unless we want to forgo with the supply of medicines in this country. Go ahead.
Yes. Next slide, please. Sir, if you remember, nagkaroon tayo ng increased price parang black market of severe. So finally, this way we will come to an end because we have given already the CPR last December 27. So that means it can now be supplied to public drug outlets. So dapat mawala na yung black market. So this will help, this will prevent overpricing in the black market. Wala na talaga dapat na black market kasi we encourage for the patients and even their loved ones to buy their medicines from FDA licensed drug outlets.
No, you know what? If you can give us a report, even a syllabus of, so the police chief is or his representative maybe is part of the panel there, and they should know how to respond. Yung black market at this time, lalo na may naghihirap, yung black market, yung nahuli, I would insist for the police to arrest them and detain them for investigation. If it's a serious offense, that will be about 34 hours of detention. And in that time, you can investigate. Hulihin talaga ninyo at ipasok ninyo sa selda. Again, I am ordering the police to arrest black marketeers. Dalhin sa istasyon, pasok muna dyan sa selda without exception. Without exception. Ang may-ari, lahat, I am putting on notice the entire PNP at itong mga and the station commanders, any transactions of black marketing of this essential medicines should be arrested. Walang exception. Kung may-ari, kasi kung ano lang, ahente, usually magsabihan sila, hindi namin alam na nagpapabili pala yung mga sales representative sa baba. Yun ang paborito nila eh. Sabihin nila, even it's a matter of violations, wala kami, yung aming mga staff lang. Do not give me that shit. Hulihin ninyo at ikulong ninyo. And I think that's a serious offense. You can detain them for 34